So we're gonna go in, so we're gonna click on the LAD, and you can see, let's see if, it's not segmented correctly. You see it here? It's going to the, it's going to this diag over here, but that's not a problem because we can come down here and we're gonna zoom in and we're gonna find the LAD. So we have the LAD here, we're gonna shift and then we're gonna click, and now it's segmenting it correctly, right? So now we can see that the LAD is segmented. And we can check the LAD here. What we saw, and it looked like severe. Now we can see that it's not terrible. You can see the lumen, so it's more like a moderate, lesion. And you can see on the left lower corner, kind of over here, that it's more like an eccentric plaque. And here, we can probably call this either mild or moderate at most, but it's mild. It looks more mild, over here on the prox LAD. A lot of calcium, and then like distally, it's fine. And this is the power of, this is a photon counting CT. So these are like 0.4 millimeter reconstructions. So you can see this is, older scanner, you're just gonna see white, over here. And we want to see if this, it's a medium caliber diag over here. That again, it's there's some distal runoff, over here. I'm not sure if you're gonna be able to comment, on this. I will try to see if we can reconstruct. Yeah, but we're not going to be able to see much, on this. When this happens, what I do is I just go back, to the multiplanary formats, and I go down on the vessel, here, and we can just do it like the old way. So we put the crosshairs on top of the vessel. So this is a long axis, of the vessel. One thing that is very important, one of the most important things that I learned during my imaging fellowship is that two long axes gives me a short axis. So I have a long axis here, I have a short axis here. There's a lot of blooming here, but you can see that the calcium is more like eccentric. So it's probably not totally occluded. There's also some distal runoff here. And again, it's a small vessel. So who cares? You're not going to go there, put a stent. It's just going to cause more problems. So let me go back to so the LAD looks more like mild, over here. So let's check, the circ. The circ also had a lot of disease. So we're going to segment, the circ. Let's see. So it's not segmented correctly. It's segmenting the Ramus, and the Ramus looks fine. There's like some plaque over here, but this is more like within the mild, moderate, at most, here. And then we have the circ. So the circ, let me click here. So this is the circ. So the circ has a lot of plaque, especially here at the mid portion. And you can see that here looks more, we can still see the lumen, but there's some areas here in which we don't see the lumen. So this looks more like severe stenosis, of the circ, over here, right? Okay. So that's the circ. And then we have the RCA. So the RCA, again, not segmenting correctly. And then we see the RCA. The RCA looks fine, for the most part. Like the distal piece here is very small, more proximally. It's more like moderate, at most, here. We have a lot of plaque, here, but it's pretty eccentric, and it's more like within the moderate range, So here it's pretty mild, and here most like moderate, range. Okay, so the main thing now is that circ, right? So I call the first diagonal, ended up calling severe stenosis, here, moderate stenosis at the prox LAD and the RCA, but there's also the circ, here that we saw. And this is the FFR CT that we sent, right? So diffusely diseased vessel, okay? So the LAD, it's abnormal distally, but it's that rainbow pattern, that is you don't have a translesional pressure drop, here. Just kind of diffusely diseased. but the circ, has some kind of pressure drop, over here. And the circ, looks more, concerning, that proximal circ, that we saw. The RCA, it's diffusely disease. Again, just to show you, that kind of rainbow pattern, over here. This patient ended up getting a stent, to the circ, and he ended up being chest pain free after that. Okay. Yeah, this is what they show at the roadmap. Roadmap again, it's doing relatively well here, calling moderate here, although it's more severe. So again, not perfect, but it's pretty impressive. That's a great question. So there are a few tricks, as we did, we do like, the higher kernels, the sharp reconstructions. We can see if in the sharp reconstructions, we still have like, severe. In the end, it might be really challenging on those patients with very high calcium scores, especially if you don't have like a photon counting CT, at your disposal. And that's kind of a limitation of the technique, right? What you can do is sometimes if the patient's pretty stable, if it's, your patient, you can offer like a functional testing to go on top of that if the patient doesn't want to get cath, or sometimes you just, cath, or, you can see if the roadmap, you're going to get the roadmap for pretty much every patient. So the roadmap will tell you if it's picking up, if it's reconstruction and everything. So in this case, the circ, and the areas that I was concerned about, you can see that it was reconstructed here. The other things that you can see is that you see like the dashes, the areas that have like, this thicker. This is areas of plaque, so plaque is detected there. So you can see where there's plaque, and you can see also where there's stenosis. So this is a preview of what the FFRCT will show. And I know that they reconstructed the vessels that I wanted, and so that's why we decided to send. If you look at that, and the vessel that you want is all like grayed out, so you're not going to send it. You're going to offer something else, functional imaging or cath. Oh yeah, this is the cath, of the patient, and yeah, they're actually this RCA kind of also looks a little tight as well.